Good morning, ladies and gentlemen. All protocols observed. My presentation this morning will focus on the status of the newborn, mortality levels, the coverage of effective interventions for maternal, newborn, and child health. We'll also look at health workforce challenges, and then look at WHO recommendations on task shifting and implication for newborn care. Now, this we have had since the beginning of this conference, that neonatal deaths account for 40% of the global under 5 mortality. But note that 38% of those deaths are from the sub-Saharan region. The major causes of these deaths, especially in the under 5, hinge on about 4 elements. There's pneumonia, malaria, diarrhea. But the neonatal period contributes the most in this region, about 1/3 of 4 deaths. Now, looking at the coverage of maternal newborn health interventions across the continuum of care, that slide summarizes the situation across the 46 countries of the WHO African region. It shows varying levels of coverage of the interventions, with some of the areas showing very low coverage, especially the critical areas for newborn health or survival, the areas around birth, labor, birth, and immediate postnatal care. And these are times when care by skilled health workers is critical. So you can see these areas here, the coverage is very, very low. Yet, unavailability of skilled care continues to be a crisis. According to the 2006 World Health Report on health workforce, it shows that there are 57 countries that have critical shortage of health workers. 36 of these are in the sub-Saharan region, as you can see. And this is the area which has the highest burden of health problems, including for newborn health. Now, even for areas where there is skilled workers, the inequitable distribution also contributes to the situation as we see it. Globally, 24% of physicians and 38% of nurses are found in the rural areas. And this is where 50% of the population can be found. Now, this shortage of workforce has been recognized as a contributor or as a challenge that will prevent us achieving the Millennium Development Goals. Now, what do we need to do? Now, we know that there is a need to improve access and quality of health care for mothers, newborns, and children along the continuum of care. And this is by having people with the right skills in the right places at the right time. Now, there is an option of task shifting, which has been identified as one of the areas that can be looked at. Now, task shifting can be through building competencies for required skills and having the required supportive environment like policy, training, motivation. And there is evidence that shows that this has been happening since the 60s, but there has been minimal documentation and there has been no guidance to that. For those who might not know, task shifting is where you have a cadre that does not normally have the competency for a specific task that is trained to deliver a certain task. Now, other options that are available out there will be increasing training. We saw for the case of Malawi how they initially looked at that before they even went down. Increasing training of 4 cadres of staff, but we know that one is a long-term solution. But for immediate term, there was a need to look at task shifting of the available workforce. Now, to do that, WHO has come out with recommendations on task shifting, and these are outlined in the WHO publication of 2012 on optimizing health workers' role to improve access to key maternal and newborn health interventions through task shifting. It's also called Optimize MNH. Now, the document was developed to address the identified need to optimize potential of the existing health workforce. The objective of the document or the content of the recommendations is to issue evidence-based recommendations to facilitate universal access to key maternal, newborn, child health interventions through optimization of health workers' role. It is aimed for policymakers, managers, other stakeholders, and can be applied at global, regional, and national level. Now, during the development, which was done through a multi-stakeholder task force, they looked at the process of the following process: identification of priority questions and critical outcomes, looking at the issue at hand, retrieval of evidence, assessment and synthesis of evidence, presentation of evidence using structured health system framework, and formulation of recommendations. Now, the document outlines 4 cadres of recommendations, starting with recommendation. The first one is where there is recommendations which should be considered for implementation. This is where there is enough evidence to show that that task can be done by the cadre of staff that is being allocated. Then there is recommendation with targeted monitoring and evaluation, where evidence is uncertain, but can be implemented at scale up, but with close monitoring and evaluation. Then there is the recommendation only within the context of rigorous research, and there was the 4th category, which was against practice, that should not be considered for implementation. Now, what is the implication for newborn health? The guideline or the recommendations, they are given for interventions across the continuum of care. So they cover for maternal, newborn, even the child, other services like family planning, and even PMTCT. Now, the guidelines clarify lay health workers' roles in health promotion and preventive aspects for newborn. Here we can look at some of the things that they recommend. Promotion, for example, of appropriate care-seeking behavior for newborn health, promotion for ANC, promotion for skilled care at birth, promotion for exclusive breastfeeding, promotion for postnatal care, and kangaroo mother care, among many other elements. Then it also includes recommendations and skills for care of the newborn by other cadres of staff. And these cut across auxiliary nurses, midwives, associate clinicians. There are many cadres of staff that are looked at for these guidelines, and they are outlined in the document. Now, more implication, there is that which we know direct implication, like good care practices for mothers during pregnancy and delivery and postnatal period, postnatal care, including family planning, Care for newborn. Again, home-based care for newborn, including promotion of breastfeeding, cord care, recognition of danger signs, and referral. There is also services that look at better care-seeking behavior for the newborn that are also addressed through these recommendations. Now, what is the key message for task shifting? Now, in total, there are about 60 recommendations for the various cadres of health staff that are there and others that might be co-opted, like we have seen for the case of Malawi and other areas that use community health workers. There is a need, when considering these recommendations, to first do an initial situation analysis of what is existing. Look at the numbers and the skills that are available and see what needs to be added and by who. There is also the need of empowering health workers being assigned these new roles. You may find that some health workers have been given some tasks they were not doing, yet they are not covered by policies, further training, and even motivation to take care of that extra role they have been given. And of course, all stakeholders must be involved. Otherwise, you implement and you find blocks somewhere on the way. Then institutionalization, and for sustainability, we need to ensure policies are in place, structures, funds, processes, all those that need to be considered for that. Then we need to identify informal task shifting that has already happened. We have seen that it has been in existence since the 60s, but it has been quiet. Nobody has addressed it formally. So this needs to be formalized. And we need to consider including that which has worked well and we think can be done within the training institutions to be placed where it belongs, in the pre-service training, so that those coming out have got the needed skills that were added to them. What about communication and advocacy? We need to ensure that all those that need to know the process of optimizing is shared among all stakeholders. We need to advocate that all stakeholders should support that which is happening where they are. Like we have heard from Malawi, it is what the government wants. So everybody should support that which is needed there. Then we need monitoring and evaluation, because this is an area that needs close monitoring so that you can keep track of the services, the quality of services, of what you are task shifting. So monitor and evaluate policy implementation and identify and address challenges and bottlenecks as they are identified. Then documentation and sharing lessons. So monitoring, documentation, sharing lessons, so that we can learn from that which is happening well. So in conclusion, there is an urgent need to scale up interventions, as we know, that's why we are here, for newborn at all levels, but we cannot hide from the fact that we do not have enough health workers or human resources. Now, there is that documented evidence for task shifting, given as recommendations for those who want to look at what is necessary and adopt accordingly. Task shifting must be context-specific, and it must happen with close monitoring. And we know, and we have heard, there is a large number of task shifting elements that still need a lot of research to gather enough evidence for a positive recommendation. Thank you very much.